Hello, everyone. My name is Jasmine Kaur, and I'm a senior anchor with the National Library of Patient Rights and Advocacy. Today, I'm extremely excited to welcome Rachel Lebovic, a recent graduate from Johns Hopkins University with a Master of Health Science in Mental Health. Rachel, thank you so much for being here with us today.
My pleasure.
Can you share a little bit about your journey and your own story about mental health and any struggles that you have encountered?
Yeah, so I started struggling with mental health probably around 6 years old. I was in first grade and I was having a hard time at school socially. I was being bullied, and that persisted for a couple of years. And I didn't understand the impacts it was having on me immediately at that age. But by the time I was 10, 11 years old, I did start understanding it. And at that age, I started experiencing symptoms of what I now know were depression and anxiety. And I was talking to my parents about this, saying how I think the social stuff is starting to affect me and how I was sad and I was scared to talk to other kids. And so they aren't in the academic field, they aren't in the medical field, so they didn't know what to do. So they took me to a professional. And I saw my first therapist when I was 12 years old. And that started a long journey with the mental health care system. I saw probably a dozen therapists between the ages of 12 and 18 trying to get help. I wanted help, but I wasn't an easy patient in the sense that I was a complex case. I would have trouble communicating with the professionals. I wouldn't be able to describe what I was feeling. They would ask me how I was feeling, and I would say, I don't know. Sometimes I wouldn't talk at all, and they would say, you're being difficult. We can't help you if you're not going to help yourself, and let us help you. And it really became a theme where I would just bounce from person to person because I couldn't find a right fit in a professional. And a big thing for me is that um, here's some context. I'm from Canada, but I did my undergrad and my master's degree in the United States. And a reason for doing that is I wanted a fresh start. I wanted a clean break to go somewhere where I didn't know anyone. And that's how I ended up in Atlanta for my undergraduate degree. And I was studying neuroscience and behavioral biology. I developed an interest in the brain and behavior in high school because I was trying to understand the world around me. I was trying to understand why I was having such a hard time, why I couldn't connect with people, why people were acting the way they were, why I felt so terrible. That's what drew me to that. And then in my first year of university, specifically in my spring semester, I had been doing well for my first semester. My spring semester, I started regressing mentally because I never really addressed the issue. It was more just change of environment, band-aid solution. And then my spring of my first year, I went home for spring break, and that was March of 2020. And it was don't come back to school after spring break. We're remote. I'm stuck at home. And that was the perfect storm. That was the last straw that then tipped me into a full-blown mental health crisis. And at that point, my depression, my anxiety, my suicidality reached an all-time high. I struggled a lot that those next few months. I was in and out of the emergency room for months. I eventually ended up taking a semester off from school, the fall semester of my second year. I took off and was receiving extensive treatment. I ended up spending 2 months in a hospital where I got electroconvulsive therapy as a way to deal with the severity that was my depression and suicidality. And it was in that hospital stay, a psychiatrist there told me and my parents that I needed to be evaluated for autism spectrum disorder. And that was something that we had never thought of, never considered, didn't really know much about, or what we did know about autism was more of the stereotypes that you would hear about a boy with autism, or what you would hear about the level 3 very severe autism. So we didn't know much. And the diagnostic process takes time. So a year later, I was diagnosed as being on the autism spectrum. And all of a sudden, everything clicked, everything made sense. It explained why I had the challenges I did growing up. It explained why I wasn't able to get the support I need from the mental health system because they were treating me like I was a neurotypical teenager who was depressed, when in reality, I was an autistic teenager who was having depression and anxiety symptoms because of the challenges of being neurodivergent and not knowing it in a neurotypical world. And so then it was my third year fall of my undergrad when I got that official diagnosis. Everything clicked. I was already studying neuroscience with this interest in the brain and behavior. Now it was solidified as the brain and behavior in the context of mental health. I finished up my degree. I then went on to Johns Hopkins and did my master's in public mental health. And now I just started my PhD this week at the University of Toronto in suicide prevention and public mental health. So, really using those experiences to inform the work I do, because it is very important that people with lived experience are in this field and able to inform the very important work that needs to be done.
Yeah, I hear you, Rachel. Thank you so much for sharing your story. It is really inspiring to hear this, and what a challenging experience you've had. But I also hear a story of resilience and perseverance, and that's really inspirational. And just for everyone who's listening to you, how did receiving your diagnosis affect your academic life in general?
Yeah, so it's a tricky question because I know a very common thing is for people to ha who have mental health challenges to struggle academically. For me, growing up, academics was never an issue. And I think that was a big factor as to why I went undetected for so long. And the reason why school was never an issue for me is because I created my identity around academic performance. That I was being bullied, I was being put down, I was being misunderstood. But no matter what anyone else said or did, I was good at school, I was smart, and no one could take that away from me. So I never let my academics be affected throughout elementary or high school by my mental health. That being said, after my diagnosis, things did get easier. I was always doing well at school, but now all of a sudden I had accommodations that I was still having the same performance, but it wasn't taking the same toll on me to do as well. Things like being able to take my tests in a private room. So that way they called it a distraction reduced environment. So that way when I take my test, I don't have to spend energy tuning out the person next to me clicking their pencil or people getting up to leave the room when they're done. Things like having flexibility with attendance. There were a lot of times when I would push myself if I was having a hard day to go to class because you have to go to class. But what I've learned is that when I do that, it just takes me longer to recover. If I push myself, then I have a bigger burnout after. So, an accommodation like flexibility with attendance, if I'm having a rough day, I can take that day to rest and then I'll be fine the next day. So from an academic perspective, my grades didn't change, but the the burden that came with performing at that academic level was lessened because of these supports I got.
Yeah, I feel that is so powerful from a patient advocacy lens because it is seeking help, it is reaching out to professionals and getting a correct diagnosis that, in your words, like you said, it made things better.
Yeah, and sorry to interrupt, that something that was tricky too is that I had never had accommodations my entire life. It wasn't until my third year of university that I got this diagnosis. I had never had accommodations and I was high performing. So when I got this diagnosis and I know that now I'm entitled to accommodations, I had no idea what to ask for. Because the only thing I knew existed was extra time, and I didn't need extra time. I that was never an issue for me. And so I go and meet with the academic accommodation coordinator at my university, and they asked me, "What do you need?" And I'm like, "I don't know what exists." And so it took time, and it's hard to have those conversations when you don't know. And
Mhm.
so it was important to ask the questions of what do you have, talk to other people who have accommodations, and learn It's not just extra time. The distraction-induced environment is an accommodation that can be given. Flexibility with attendance, stop the clock breaks on tests, all these things I had never heard of. And all of a sudden were available to me. That just made things easier.
And that is so powerful, the correct resources and the help that you get from external resources, especially academically. That's very powerful. So how has your experiences with mental health advocacy and talking about your experiences shaped your own perspective on public health and stigma regarding mental health issues?
Yeah, stigma is definitely a big thing. And I think stigma also contributes to why I went undiagnosed and unsupported for so long, that I was afraid to talk about things. I mean, my parents, they are incredible, and I would not be alive today without them. They did everything they could, but they only knew so much. I mean, they work in construction. They did not know what to do when their 12-year-old said to them, I'm sad. I don't know what's going on. And so the stigma piece, it made me scared to ask for help in certain situations. I'm sure it made them uncomfortable asking their network for help in certain situations. And I think a big thing post-diagnosis that I've noticed is I am very open, obviously, about my lived experience. I'm here giving this talk today. And I was told not to do these things. When I decided that I wanted to go public with my experiences, it was 1 year after my discharge from my 2-month hospitalization that I decided I'm posting on Instagram, I'm going public. And I was told, are you sure you want to do this? I actually wrote an article that was published in Healthy Debate, which is a Canadian healthcare conversation journal. I wrote an opinion piece, and it was about this, are you sure you want to do this? A question that I was asked over and over and over again. Are you sure you want to tell your story? People are going to judge you. Are you sure you want to talk about this? If you want to advance yourself in academia, you're not going to get into graduate school if you talk about this. I wouldn't want to hire you. I wouldn't want you in my medical school class. You're a liability. And it was so frustrating because I knew the importance of lived experience in this progress. And I knew that I was capable, and I have people in my circles that I've seen who are extremely capable, even though they have mental health challenges in their history. And as I was talking publicly about it, I connected with people who have mental health challenges in they're in professional positions, but they've kept it a secret because of the fear. And it's a real thing. As I said, I'm doing my PhD now. My personal statement involved mental health, and I got in. But before, I spent a lot of time deciding or thinking about, do I want to do medicine or public health? And I was doing the pre-med process, and I was preparing my applications. And in my personal statement, I wanted to talk about my mental health journey because the statement is, why medicine? Why do you want to be a doctor? And my mental health journey is the reason. And so I wouldn't know what else to write if not this. And I was told it's really risky. It may not be the right move to do. I did it anyway because my philosophy was, this is me. If they don't want me, that's a them problem. I'll be amazing somewhere else. And I actually got an interview from a very well-regarded university in America. And my interviewer was a psychiatrist and was talking about how he loved my essay. And our entire interview revolved around that conversation and how important it is to talk about these things and how important it is to have people with lived experience in these fields. And so it's definitely tricky because on the one hand, the stigma is still out there, and there are people who are going to see these things and hold it against you. But there's a lot of people who aren't. And as a society, we're moving away from that stigma in the academic setting. And the more of us with lived experience who then get into these fields, in 20, 30 years, I'll be the one reading the applications, and I won't have that stigma towards it. Um, so I guess I would say to anyone, tell your truth, obviously within the realm that you're comfortable. At the same time, your medical history is your private history. You have the right to decide if you want to share it or not. But if you do, share it. And if they don't want you, you don't want them. And you will go and be amazing in an environment that does want you and does value you and recognizes the importance of your experiences and what you have to offer.
Thank you for sharing that, Rachel. It is, again, also inspiring just to be a part of this conversation. I'm pretty sure that right now it's your voice that's going to stay with the listeners. And like I always say, it's the ripple effect. All it takes is one voice. And somebody, who will listen to this will feel inspired. So all of those people, what do your future goals in mental health advocacy look like? And how do you plan to achieve them?
Yeah, so as I mentioned, I'm starting my PhD in suicide prevention and public mental health. I'm doing it here in Canada, where I'm from and where I hope to build my career. I hope to use my unique skill set that comes from having both the lived experience and the education. I think a lot of people have one or the other, that you either have the lived experience but don't really understand the intricacies of the systems, the research, the policy advocacy side of it, or you have the education but don't have the lived experience to piece it all together. So I'm really excited to join the community of lived experience professionals who have both and hopefully use that skill set to work in public mental health and create programs and policies that promote mental health and well-being and also prevent mental illness. And then a big thing that I'm doing too is I actually just created a charity called 25 Alive. That's a passion project of mine that I hope to grow into a large organization for mental health, promotion, well-being, thinking about advocacy, thinking about peer support and education for parents and students and teachers. The the idea behind that, I came up with it while I was in the hospital. I wrote it in my journal while I was in the psych ward, and I wrote idea charity called 25 Alive. And the whole idea there is let's help kids make it to 25 alive. A big interest of mine is transitional age youth. So thinking about that 18 to 25, where you turn 18 and you're an adult, so you can't work with the youth system anymore, but you're only legally an adult. Biologically, the neuroscientist in me knows that our brains aren't finished developing until they're 25. And not only that, the level of development that happens between 18 and 25 is so significant. And that age group is a it's a mishmash for mental illness onset. There's so much in that age group, but they fall through the cracks. And making it to 25, it's not this some magic number that if you make it to 25, you're, good forever, but it's such a big milestone for someone with mental health challenges to make it that far. So the whole idea is let's make it to 25 alive. So on top of my PhD and professional goals, that is something that I have that it's new, but I'm hoping to grow that and have it go hand in hand with my professional and personal goals related to mental health, education, advocacy, policy, etc.
I feel so proud to listen to this story. And I'm pretty sure all the listeners and our team at the library is honored to have you as a guest. Thank you so much, Rachel.
Thank you for having me.